I'd like to take this opportunity to thank MacPFD for allowing me to present on keeping afloat development of an innovative clinical placement model to meet clinical education demands during a pandemic. I'm Jasdeep Deer. I'm the current acting director of clinical education in the physiotherapy program in the School of Rehabilitation Sciences. I also wanted to start the presentation with a land acknowledgement. I'm currently at my office in McMaster, so McMaster is located on the traditional territories of the Mississauga and Haudenosaunee nations and within the lands protected by the Dish with One Spoon. I also wanted to pay special attention and give acknowledgement to the individuals that were a part of this project that is now turned into a case report that's been submitted for publication. And that is Amy Connell, Magda McCann, Diana Hatzgaloo, Dana Ajami, Andrea Firstman, Dr. Sarah Wachowski, and Dr. Michelle Coe for all of their work, innovation, and efforts with this project. So just as a primer for the group, what's required for our students to meet clinical education demands, all of our physiotherapy graduates are required to complete at least 1,025 hours of clinical education. They need to track hours as they relate to neurological skills, cardiovascular skills, musculoskeletal skills. They need to have various exposures to acute, rehab, and ambulatory care. And all of these, or the majority of these hours, need to be supervised by a registered physiotherapist, as well as have a component of direct clinical or interaction with patients. So you can imagine when there has been a pandemic that's directly impacted our hospital organizations, that meeting these demands became extremely challenging. So balancing the needs of our students, meeting the need for an acute care exposure, as well as tracking skills in CVR and neurological care, as well as considering some of the pressures on the hospital systems, like restricted number of learners, redeployment of clinical instructors, and the immense pressures on our clinical instructors and healthcare workers, became an extremely challenging time. And it was challenging to acquire the sufficient number of clinical placement opportunities for our students to meet demands, as well as the needs for graduation requirements. In addition to some of the pandemic-related challenges, evidence supports that there are some other identified barriers for clinical instructors when they consider taking a student and supervision for physiotherapy students. These include increased stress, perceived increased workload, some environmental constraints like time and space, as well as student personality and lack of workplace support. So in consideration of the pandemic challenges and some of the other identified barriers, we found ourselves in a situation where we needed to acquire sufficient clinical placements, but needed to continue to consider what our students needed to graduate. So what we did is we developed a collaboration that was made between the McMaster Physiotherapy faculty, a second-year physiotherapy student, and the team, the physiotherapy team and placement coordinator at St. Joe's Healthcare Hamilton. So what we did in consideration of some of the identified barriers for supervising students, as well as some of the challenges that were being placed because of the pandemic, was we created and developed a float placement model. Traditionally, a float placement has been described as a role in a hospital organization where there'd be one individual that would float across hospital units to meet organizational demands. In this specific model, what we looked at was a student floating across hospital units based on the feasibility and availability of a clinical instructor. So this model looked at organizing a multi-hospital unit, multi-clinical instructor placement. The assignment of a primary clinical instructor was pivotal in making this model a success. The development of overarching goals, so that there were goals that a student could use and try to meet and achieve across all hospital units, was necessary as well. Development of a plan for all clinical instructors to contribute to student evaluation was also necessary in order to ensure that the primary clinical instructor was receiving information from all the clinical instructors that were a part of this model. So how did we evaluate this clinical placement? We use the typical evaluations that we use across any other clinical placements in McMaster. So we use the assessment of clinical performance and the learning contract. This is a way a clinical instructor would evaluate a student performance. In addition to these evaluations that are typical for clinical placements in the physiotherapy program, we also collected reflections on the float model. These reflections were collected by each clinical instructor that was engaged in the model, as well as by the student. 3 individuals assessed these reflections and came up with themes. what we noted were that there were several comments related to the clinical instructor and student attributes that were necessary to make this model a success, as well as managing expectations, increased feasibility, varied exposure, central communication and resources, and this spoke specifically to having the primary clinical instructor, and the organization of the placement. Based on the themes, we also were able to develop 10 tips that we would then share across several disciplines and organizations. We recognize that collection of clinical placements, especially in acute care, is challenging. So we thought that this model could be, and the information gained from this clinical placement could be extrapolated and then used to provide other organizations and physiotherapy programs with opportunities in how they can explore development of this model. Some of the tips we came up with, specifically as they relate to organization of the placement, were recommending that the site plan the placement early, include a minimum of 2 consecutive weeks for each rotation. We recommended that the site provide information related to placement organization, including timing of rotations and units to the university program. The assignment of a primary clinical instructor was pivotal to the success of this specific clinical placement model. We also recommended that following student assignment, the primary clinical instructor and student identified overarching goals. This way, despite being across hospital units, the student was able to be directed towards specific objectives that would be evaluated throughout the clinical placement. We also recommended that the clinical instructors prepare an outline for each rotation so that the student would be able to manage their expectations on what they would be presented with within each hospital unit. As it related to implementation and execution of the placement, we recommended that the clinical instructor include 1 to 2 days of orientation. This was important so the student could become acclimated to the patient's types that would be presented in those specific units and oriented to the environment. We also recommended that the primary clinical instructors, CIs, and student ensure communication and planning opportunities for frequent and timely feedback. Given that this placement model took place across 4 hospital units, as well as 5 clinical instructors, ensuring communication across all of those individuals was extremely important. We also recommended that the primary clinical instructor, the clinical instructors, and the students plan transition meetings. This would mean that after each 2-week rotation, there would be a handoff communication that would take place prior to engaging in the next rotation. We also recommended that the primary clinical instructor and clinical instructor plan communications to ensure evaluations were informed by all supervising clinical instructors. We are hopeful that by providing these top 10 tips, other disciplines or other physiotherapy programs are able to take these implementation and organizational tips and develop their own float placement models. What did the float placement model help us to achieve? Well, it allowed the site to improve the feasibility in offering clinical placements. Clinical instructors found that it was perhaps easier and more feasible to their schedules to offer a 2-week clinical instructor supervision as opposed to an 8-week. For the program, it assisted us in acquiring placement offers that resemble entry to practice positions and meeting graduation demands. For the student, it offered more opportunities to gain exposure across several hospital units, and again, meet those graduation demands of clinical settings as well as collection of hours. Thank you so much for listening.